So when you're evaluating a choice for a program, I think it's important to look at what the programs are claiming or promising they can do. So when you look at opiate detox, I think the first important thing is we need to treat the opiate dependence, because that's one common feature of all the patients we see is they're all opiate dependent, and they may be benzo dependent, they may be using methamphetamine and other things, but the core issue we're looking at first is the opiate dependence. And as Claire mentioned, opiate use affects hormones, it affects testosterone production, it affects dopamine, norepinephrine, serotonin, and all those neurotransmitters and hormones are out of balance. They're just out of whack from the opiate use. So once we remove the opiates or treat the dependence, then we need to deal with that as afterwards. So I think when you're looking at treating the opiate dependence, number one is somebody going to carefully evaluate the underlying medical issues, carefully look at what substances somebody's using or abusing. And very rarely it's just opiates anymore. The majority of patients that are using fentanyl from the street are also using methamphetamine now to, the opiates suppress, and the methamphetamine, keeps them awake and counteracts a lot of the sedating side effects. So you have to have a good understanding. And there's some cases where I'll evaluate patients before they're even admitted to the program. And if there's underlying medical concerns I have, we'll request additional medical records, additional testing. So before someone even comes out to see us, I want to make sure that I have an understanding of their underlying medical history. And then once you get to the hospital, I think it needs to be a full service hospital, credentialed, that has all the appropriate personnel and capabilities. I work with a cardiologist with every patient. We do x-ray testing, we do EKGs, we do blood work to really have a full understanding. I think, as Claire mentioned, the day before admission, we get to hydrate patients and flush out the drugs that we know about and the drugs we don't know about. We have xylazine in the fentanyl now. There's a lot of other things we're dealing with that patients may not even be aware of. So I think the pre-medication, the pre-evaluation, all of that is essential. And then you have to have somebody's doctor performing this that's had experience, that knows what to look for, knows what to expect as possible, possibly can occur during, and that should be performed in a setting like the ICU where you're ready for it, whatever. And you just want to keep these patients stable and safe and comfortable. And then afterwards, as Claire mentioned, there's a lot of things that we now have to address. Patients have been masking mental pain, physical pain, and all of these things we now have to deal with in an appropriate supportive setting, aftercare where it's professionally staffed and we can give medications to help provide some comfort as the body has to transition to find its new normal. So, we need to support the patients with some medications, with therapy, with all those things to make them successful.
Mm-hmm.